Hey guys, everybody, welcome to this, our first kind of video chat video lesson. In our video lesson, we're going to be showing you a couple of things regarding spinal anatomy. Spinal anatomy as it relates to, first of all, we're going to be talking about the cervical spine, so Atlas and C1. We're using a program called Visible Body. All the images belong to them. We've just taken the pictures from the images and uploaded them into learneverything.com. And then we're going to start pointing out stuff there. So we're going to have a very nifty anterior, posterior, inferior, superior view and how Atlas articulates with axis. And hopefully you guys can use this as a study guide going forward. So in this first slide, you'll be able to see the anterior and the posterior view of Atlas. And then we'll take here, we'll start utilizing our little markers here to point out certain anatomical landmarks. So the first landmark that we want to point out is the anterior tubercle of Atlas, which is right here. So that's the anterior tubercle of Atlas. We got to remember this is the anterior or the front part of Atlas. Then we'll go forward from there. So we're doing that. That's the anterior tubercle right here. And since this is also the superior view of Atlas, we're looking at a top-down view here. We'll point out a couple other things. So these are the posterior arches of Atlas. This whole thing is the posterior arch of Atlas, actually. However, I want to point out that when you're here, I want to make a special note about this portion right here. We'll mark it in green, so that special portion right there. That is the posterior tubercle of the posterior arch of Atlas. So I want to make note of that. Then, since we are, like I said, in a top-down view, we'll note this particular part right over here. Might be a little too thick there, so we'll use this one maybe a little bit less thick. And the green area right here, that's the articulating facet of the superior articular process of Atlas. Now, the superior articular process of Atlas is part of the lateral masses of Atlas. Now, the lateral masses of Atlas are what would be equivalent to the articular pillars down the cervical spine, pars interarticularis going down the thoracic spine, as well as the lumbar spine. So we'll see those going forward. Now, again, these are the superior articular processes, and inside you will have the superior articulating facets, which would articulate with occiput, or the occipital condyles, which would be the bone that articulates superiorly to Atlas. So then over here, moving forward, in the red, we'll have the transverse processes of Atlas right in there, right in there. And then inside Atlas, we'll have a couple of ligaments that we'll point out in the next couple of slides that articulate with the dens or the dens of C2. Also very important to note in here in Atlas is this guy right here in the blue that I'm circling currently. That's the foramina, the Atlas foramina. And this other big old hole is Atlas vertebral foramen. So that's initially where you're going to start seeing the spinal cord. And here is where the vertebral artery and vertebral vein pass through. So you're going to be seeing those as well. Again, here we have an anterior view of Atlas. So we'll be able to see, I'm going to circle the lateral masses here and here. Then obviously the anterior arch would be right here, and the anterior tubercle will be right in the middle. Right on the sides would be the transverse processes. And then here you can see in green the inferior articular process, and the superior articular process would be up top in the yellow. So that's the anterior view of Atlas. So it's pretty simple. Over here we have, as it notes here, the inferior view of atlas, where we'll be able to see the inferior articular process, which articulates with C2, and then the inferior articular surface, which again articulates with C2. So another view of the posterior arch, all this in green, not now, posterior arch, and then that guy right there is the posterior arch. It's a posterior tubercle of the posterior arch, and again, you'll have the transverse process over here, vertebral foramina right there, and a little better view of the anterior tubercle of atlas. So that's the inferior view of atlas from top down. The only difference that we're seeing here again is these inferior articular processes and inferior articular facets. Once more, we have the anterior view of atlas. However, we have decided to include the ligaments that articulate with dens, so, or not dens actually, C2, or the dens of C2. So here you have the anterior axial ligament, anterior atlantoaxial ligament. So this is the ligament that actually articulates the anterior portion of atlas to the anterior portion of C2. So that's why it's called the anterior atlantoaxial ligament. As we know, C1 is called atlas and C2 is called axis. So the junction of the two would be atlantoaxial. That right there's a ligament. On the other slides, we'll be able to see a better view of how they articulate. So if we take a look here, we see how they actually articulate. You can see that the ligament actually attaches to the body. This would be the body of C2. And this would be the superior articular process, superior articulating facet of C2. And you can see it articulates pretty well with the inferior articular process and inferior articulating facet of C1. So again, this is the atlantoaxial ligament right here as it articulates with the body of C2. Here we have a nifty little view of the posterior portion, and we'll be able to see the posterior atlantoaxial ligament here circled in red that articulates more with the posterior portion, kind of the lamina and the body, actually the lamina of C2, the lamina being this area right here, laminar shield-like surface. So right there in the blue, so as to differentiate them from the the posterior atlantoaxial ligament. And then we'll see here the spinous process of C2. Now it's called the spinous process. It sticks out a little bit more. Note that the atlas does not have a spinous process, but it has a posterior tubercle. So the posterior, the spinous process of C2 is sometimes bifid, which means that it does this and it sticks out. It looks like little teardrops like that. So sometimes that we would have a bifid spinous process. So we have those there. We have the posterior atlantoaxial ligament articulating with the lamina of C2. Now in other videos, we're going to describe C2 a little bit more in depth, so I'm not going to go and mention any of the structures that are surrounding this. I just wanted to point out the spinous process and the lamina to which the posterior atlantoaxial ligament articulates. Last but certainly not least, we have a top-down view of all the ligaments and how they articulate with atlas and axis. So we're having a top-down view. So just to orient yourself, this is anterior, this is posterior. So again, right here in the blue, it's the spinous process of C2. This in the green is the posterior tubercle and the posterior arch of C1. So these guys right here are the cruciate ligaments. As you can see, they hold that round or spherical looking structure. That would be the dens of C2. This right here, that's being circled in black, that's the dens. So in front of the dens, all the way down to the body of C2, you have the anterior atlantoaxial ligament. It's going to be right here in the red, as you can see if you trace it along. These ligaments, the blue and the red, hold the dens in place, whilst the atlantoaxial ligament holds C1 and C2 in place. It prevents anterior displacement of that area, as well as here with the cruciate ligaments, it prevents posterior displacement of the dens, and it kind of keeps the dens in place, and it allows pivot movements and stuff like that. Here in the green, we have part of the tectorial membranes there, which kind of attach to the sometimes they're called or not they're called, they attach in a diagonal sense, kind of like alar like, kind of like wing like, but they're not necessarily that. And then you can see here we have the posterior atlantoaxial ligament, which attaches from that posterior arch back to the lamina of C2. So that's it for today. I hope this helped you guys out, and we'll be producing more videos as we go along to kind of show you how this works.